Hi everyone, welcome to Lisa's Unfiltered Flock. I'm just going to preface everything right now. It has been one hell of a week. So you may see a cat walking around. You will probably hear some kittens crying, maybe growling, but I'll get into that in a little bit. So here we are. I wanted to do this video earlier, but again, busy. Work is busy. My mother-in-law was just here. My bonus twins had their 13th birthday. They got sick. Our rescue kitten, who is 10 months old, on Monday had an ultrasound, found out that he had only one functioning kidney. Wednesday went for a surgery consult, and then Thursday had surgery to have his kidney removed. So he has one kidney. We have him in our room because we do have 6 other cats, 7 total. Yes, we're crazy. So he's in a playpen. He cannot be running around and being crazy, and he's a kitten, so that's what he wants to do. So I kind of have to have him away from everyone, especially the 2 other new kittens that we have. So we got 3 total rescue kittens. And then my Buttons in here is not very happy having a visitor. So well, she'll get over it. So anywho, the point of today's video, it's going to be in 2 parts. So I do want to go over my symptoms, and I will include a list of all the symptoms below that have been really shown to be with everyone. Like, everyone seems to have these symptoms. So I'll kind of go over what this video is going to be, my not so severe symptoms, symptoms that I am having, symptoms that could be like a bucket, if you will, of, I don't know if it's due to the breast implants, age, other symptoms, genetics. So I did have to write something down because, again, not thinking very clearly as of late. The first one is fatigue. There is a running joke in my house. Usually if I'm up past 7:30, someone will say it's past Lisa's bedtime because I go to bed early all the time. Even if I get a decent amount of sleep, the next day I wake up and I'm on the struggle bus. It's pretty bad. No amount of caffeine can help. It doesn't even touch it. Today, for example, woke up and I had a Starbucks, one of those new apple crisp macchiatos, which are delicious, by the way. I did have 2 shots of espresso. It did originally have 3, but I did 2 shots of espresso. An hour later, I was taking a nap. Excuse me. So caffeine doesn't seem to touch it. I was drinking like 2 Red Bulls in the morning, having to have a Red Bull at lunch just to make it through the day. I am currently trying to cut out the caffeine. Sometimes my days are good and sometimes not so good. But there are days, weekends even, where I just stay in bed because I just don't have the juice, I don't have the go. And I know I'm older, but I'm not that old. I should not feel like I just don't want to get out of bed because I'm just that tired. So that is one that's been affected me. The second one I touched on my first video is that brain fog and memory loss, where words just can't come to me. Simple words, people's names. If I'm trying to talk about my son's girlfriend, sometimes I can't even remember her name, and it sounds just like his name. My son, Abraham, Abe, or Abby, her name is Abby. How can I not even remember her name? That is so simple. So there's just things like that. Again, with age, I used to say it was mommy brain. I used to always joke, oh yeah, you know, mommy brain, it's a real thing. And I know that's a real thing, but that should not continue once you have your child. But I always blamed it on mommy brain. 20 years later, not a thing. So definitely seen that get worse over time. And, you know, my husband used to joke about how, you know, words are hard. Well, words are hard for me. And maybe that's the problem. And hopefully I will become my normal word-y self when they are removed. Hopefully. I mean, I can't guarantee. they say, you know, healing could take up to the very next day, a week later, 2 years later. I mean, I've had them for over 20 years. So if it's taken this long for them to start affecting me, I would imagine that it would take a little bit of time for me to detox and get back to my normal self. Muscle pain. Oh God. So when I did start working out back in 2017, I did have an issue where I had hurt my shoulder. We thought it was just maybe doing too much weight or whatever. I did go see an orthopedic surgeon. They did a scan and didn't show a tear, but they just kind of assumed I might have pulled something. So I did physical therapy, which seemed to help. And I think it might have been 2 months ago now, where I woke up and my entire right side was just on fire. I could barely move, and it's still that way. When I'm driving, I cannot just turn my neck in order to see out the window. I have to turn my whole body, and even turning my whole body still hurts. So from here all the way down, back into my shoulder, and even down my arm a little bit is so sore, and it hurts to move. When I originally laid down, it hurts so bad, and trying to get up, sometimes I just can't. I have to lay there for a little bit before I can even move to get up. I've done muscle relaxers, I've done TENS units, I've been seeing a chiropractor, I've been getting massages, I take Epsom salt baths, you name it, I'm doing it. Now, right now, 4 weeks prior to surgery, and mine's in a little over 2 weeks, I can't have any kind of ibuprofen or Tylenol. I even have to stop my birth control pills. So I've been breaking out, and it's not pleasant, but you got to do what you got to do. So that's another one. I just can't get rid of this pain. I don't know what caused it. I haven't been doing anything crazy with working out. When you do the tempo that we have, they start you off with, you know, the weights that you can use, and then you adjust. And I certainly was not going crazy with my upper body workouts. So a lot of women do complain that they have this stiffness and soreness that just doesn't go away, and it doesn't get better no matter what they do. But after they explant, that stiff neck, that stiffness goes away. That leads me to that second part, inflammation. So when I do go get my massages, they're like, holy moly, your back is so gnarly. It is just crazy. The chiropractor said I had trigger points, and you can feel every single knot that's in my neck, shoulders, down my arm. Sorry, I should have had some water. But I do find that sometimes I wake up and my face is just so swollen. My eyes they look like they're sunken in because this area is just so swollen. Another thing is your dry eyes. Now, that I did have LASIK surgery years ago. That's a symptom of LASIK surgery. So could my red eyes, my dry eyes be because of my LASIK surgery, or could it be because of my implants? I don't know, but it's definitely something that I'm going to look for after I explant to see if it's improved or not. Easy bruising. I had my birthday party. It was an 80s themed dinner, murder mystery thing. It was so much fun. But I did play a scene where I had to die, and I was very theatrical, and I fell to the ground, and we have tile in the kitchen, and I whacked my knee so hard, and it bruised. This was the end of July. My knee is still bruised. So it's now going on a month that my knee is bruised, and it's tender. It hurts, like not the bone, but you know, that skin when your bruise hurts. So I really didn't put two and two together. But over the years, you know, you go, oh, where did I get that bruise? I don't even know, because you would know if you hit something hard and you had a bruise, but I would get bruises and not know where they come from. So could that be? I don't know, because it wasn't really anything that I paid attention to. Another symptom that they say is like a throat clearing, cough, choking, difficulty swallowing. I swear, probably within the last year, I have a drinking problem, if you will. That's what they call it. That's what my family calls it, because I'll just be drinking my water, and the next thing you know, I'm choking on it. Or I'm lying in bed and I am chewing on a piece of ice or something like that, and now all of a sudden I'm choking, and then I'm coughing and hacking for the next 5 minutes. So I just thought that was something that happened to people, but again, because it's being listed, could it be my breast implants? Maybe, I don't know. So that's something interesting that I'll be looking out for after I explant, to see if that improves or not. Frequent urination. This one's a good one. I was even given a pair of socks by my husband for Christmas one year that says, I have to pee. And they do joke, even the kids know. When we go out, when we're on vacation and we're at Disneyland, I stop at every bathroom on the way to pee. I pee. I will make everyone else pee as well, because I think everyone has to pee as much as I do. But I do pee a lot, you know, and I always thought that that had something to do with the fact that I had a C-section. But maybe not. Maybe it could. Again, something I'll be looking for. Chest discomfort. I know I have breast implants. I know it's been a long time, and every once in a while I would get like this sharp pain. And it wasn't all the time. And usually when you have something happen all the time, that's when you pay attention to it. But when it only happens every once in a while, you're just like, oh, okay, there it is, and there it goes. And they do talk about heart palpitations. We're gonna cut that part out. Another thing is hair loss and dry hair. I was diagnosed with an autoimmune disease, autoimmune premature ovarian failure. I'll talk about that in my part 2, but part 2, not part 1, part 2. And that it did cause me to go into menopause. And menopause does cause hair loss and dry hair and your hair changing texture. So the autoimmune disease, I believe, was caused by my breast implants. The hair issue, was that because of menopause or because of the breast implants? I don't know, but I do think that that ties together with the hormones. Weight problems. Again, I was always a very thin girl, high metabolism, and then I had gained a lot of weight in a little bit of time, which I later found out, again, was because of the premature ovarian failure. My hormones were absolutely depleted. So the breast implants did have a correlation with that, but was it because of the premature ovarian failure or whatnot? But that was related to this, but not directly, just indirectly. Headaches. This is also going to tie into blood pressure. So headaches and blood pressure are two of the symptoms of breast implant illness. My family does have a history of high blood pressure. I got my implants, then I was pregnant with my son. I did suffer from preeclampsia, and my blood pressure was extremely high, even to the point where after I had an emergency C-section, after I had him, my blood pressure still didn't go down, and I was on blood pressure medicine for a while after I had him. So was the preeclampsia because of my high blood pressure? Was the high blood pressure because of my breast implants? Was it genetic? I didn't then have a problem with blood pressure until one of my cats had attacked me. Because, long story short, we were introducing cats, there was some redirection, and my hand took the brunt of it. I ended up in urgent care, and my blood pressure was taken, and it was really high, And they said usually, you know, oh, we'll take it before you leave. Usually when you suffer from a trauma like that, your blood pressure is going to be high. So they just chalked it up to that. But then I was having issues with blood pressure when I would go see my gynecologist. And she didn't say anything about it either, just chalked it up to white coat syndrome. I wasn't really diagnosed with a blood pressure problem until 2017, when I finally was like screaming for help from doctors going, something is wrong with me, please help me. I've been on blood pressure medication. Now, is it genetic? Could be. Is it residual from my preeclampsia? I mean, I don't know. They don't really get to do testing on pregnant women about these things. Or is it because of my breast implants? Once I have them explanted, if my doctor wants me to go off my blood pressure medicine, or maybe one, because I'm on 2, we'll see, and I'll let you know for sure. But that one is just kind of, I don't know. Another symptom that's not really listed, but I've heard women talking about it, would be teeth grinding. And I didn't think anything of it. I have broken teeth, and we kind of narrowed it down to the fact that it seems like I'm grinding my teeth at night. And of course, I don't know that I'm doing it. And not only have I broken teeth, but I have broken 2, not 1, 2 bridges. And not just the bridges, also the temporary ones that they put on between the time. So clearly something is going on there. I could relate it to stress. Am I in a stressful position at work? Yes. Sometimes does life stress you out? Absolutely. Is this something that kind of just started to come on within the last year or so? Yeah. I never had a problem with grinding my teeth or my teeth breaking. Could it be, age, because your teeth just kind of do weird stuff when you get older? It's possible. But if you heard of anybody that has broken 2 bridges in the matter of a year, please let me know. Comment down below so I know that I'm not crazy. But I really think that it would have to do with that. But again, I don't know. And of course, the night guard that I had made doesn't fit anymore because I have different bridges now. So anyway, there's that. That is a list of my symptoms that I have been having. And could they be related? Possibly. Could they not be related? Possibly. Are they truly affecting my life? A little. The hair thing, it's whatever. You can make do with whatever you've got. The fatigue, that one definitely. The brain fog, oh God, absolutely. It just drives me insane. The frequent urination, whatever. That, I can deal with. The muscle pain though, that's been affecting me pretty bad. Like, it's just a freaking nightmare. And you do what you got to do. And I try not to have ibuprofen or Tylenol because of my liver enzymes, which we'll go into later. I try to lead as much of a drug-free life as possible when it comes to that, because I know that there are known side effects to taking too much ibuprofen, to taking too much Tylenol. My cat just got my scrunchie. She likes to take them and put them in a water bowl. So I just had to watch her do that just now. So thank you so much for listening. I hope you got some good information out of this. I hope you can share this with somebody who might be having similar issues and just think it might be their age or stress or situation. And look out for part 2. That will be coming soon. It will contain a lot more of the hardcore systemic issues that I've been having and the fight to find out what exactly is wrong with me and why are these things happening to me. I hope you are having either a lovely morning, lovely evening, lovely whatever. I don't even know what day of the week it is anymore. Thank you so much again for watching.